Hello, this is Dr. Do again. This video is another video continuously from the systemic approach of medicine. Just to remind, I started with the four major organic compounds. I move on to the organelle level inside of the cells, and then talk about the each time I talk about the either the organic compounds or the organelles or the cells, talk about diseases associated with those structures. And then I move on to the visible, which are the tissues. A group of cells together carry on certain functions. That's the medical definition for tissue. And I talk about the epithelia, which is the lining surface structure. And I use some examples of diseases to talk about the epithelial tissue associated diseases. And then I talk about the other major, one of the most complicated tissue, which is the connective tissue. And I start with adipose tissue associated diseases, and the last time I talked about the blood, which is connective tissue, and talk about the it's kind of wrapping up a summary what I have talked before. The diseases could occur in the blood. Actually, that probably should. It's a good idea to have another video on the details of the blood. But since I had the previous stream on individual red blood cells, white blood cells, and platelet-associated diseases, so I'm now going down further. And today I'm going to talk another a group of diseases associated with this connective tissue, which are the joint diseases. The connective tissue, of course, the joint. If I talk about joint, you already know the structure is in your mind, which is the bone, cartilage, and also the fibrous structure around it to make the capsule, or either the articulum, for example, or the sac of capsule. So this is about basically the structure of joint. I'm not using the anatomical terminology, but this is just explain the joint. So all of these structures around the joint are the connective tissues. So for example, the cartilage is one of the connective tissue. The bone, osteal tissue, which is the bone is formed by the osteal tissue, which is also a connective tissue, and the fibers, of course, one of the major connective tissues. So this is the joint disease is not new to anyone. You're already familiar with it. Basically, the joint disease can, I just summarize it. I think previously I talked about the arthritis. So the joint disease is basically either trauma, acute or chronic trauma, or degenerative, or the immune caused, or infection caused, or idiopathic. So basically, this is the whole category, probably not include or covering every etiology of the arthritis, but these are the major ones. For example, the trauma, acute trauma during sport, you twisted your knee, twisted the ankle, whether there is or there's not a fracture, or just the muscle strain. Of course, the tendon, the ligament is going to involve the swelling, the inflammation. So this is the acute phase. And chronic injury, which means repeatedly used with the force, particularly repeatedly used with the force not following the mechanical alignment. So that's and also some special genetic markers impose the risk factor for this kind of chronic injury caused arthritis. There are different kind of either. I think I previously mentioned about the joint disease. You can follow those arthritis. And the other category is the degenerative change. This is similar to the chronic injury, but it's a little different. This degenerative change also occur in some special people who have the genetic factors, different kind of markers impose the higher risk compared to the people who do not have those markers. So this is another category. And on top of that is the autoimmune caused arthritis. Probably that's one of the most common cause of arthritis. For example, the rheumatoid arthritis. It's you already know it. Probably it's majorly occurring in the female more than male, and the joint usually small joint and symmetrical. So that's the and diagnosed with the serology test on top of the clinical presentations. Actually, there's another category. It's also on top of all of these categories. There's another category. Is the arthritis associated with systemic diseases. Those usually are really similar to the cause, probably either genetic. For example, the psoriatic arthritis. Psoriasis itself is genetically caused. The majority of the psoriatic arthritis is also associated with the special genetic markers. Or the other type of, like for example, the inflammatory bowel diseases also have the risk for the arthritis. So this is another digestive disease, like the small intestine disease, like celiac colitis. So so these are all the group of arthritis associated with this systemic diseases. So this is about, I just touch every very superficial, every different kind of arthritis. And there's another one which are called infections. Infectious arthritis could be bacteria, could be viral, could be part of the systemic infection, sepsis, or could be just localized infection. For example, the skin was broken, and probably the skin, the wound, during the healing process, there's not very well healed, complicated by the infection, cause those local arthritis is also possible. Or the arthritis is a systemic infection, either typical or atypical bacteria caused, or part of the viral infection. For example, there's some young people had the upper respiratory tract infection, and then later on, a couple of weeks later, developed this viral caused, especially children, actually, viral caused arthritis, the pain on the joint. So this is another category of diseases associated with this joint. And also the joint, we have different kind of joints in the body. One of the most complicated joint is the shoulder joint. One of the common cause of shoulder joint problem, actually, on top of those arthritis, it's probably just the chronic impingement, or probably just the chronic use. It causes the weakness of the surrounding structures, cause this chronic pain. So if that's the case, if you have chronic shoulder pain, it's a good idea to see your physician, either through the anti-inflammation medication treatment, or the physical therapy, or the other surgical procedures to make you feel better, to alleviate it of the pain, just make the pain feel better. So if that's the case, you probably it's a good idea to talk to your physician. I think it's quite common, particularly for middle or older aged people had a past medical history or past history of injury, but not a very serious injury, just chronic. So if that's the case, see your physician. So this is about another type of connective tissue-related disease, which is joint disease. I just put everything together, and I had mentioned in my previous stream of video. If you're interested, you can follow those, or you can search. Thank you for watching. I'll see you next time.